Dr. Zarasa and I are here to update you all on the city's continued preparation for the possible spread of the COVID-19 virus. Just a few hours ago, we learned that Maryland had its first coronavirus case unrelated to travel. This is an indication that we've entered a new phase of the virus where COVID-19 may be spreading from person to person within a community. I have to remind everyone that we have to remain calm and listen carefully to our healthcare professionals. And in Baltimore, we're fortunate to have an amazing health commissioner leading our efforts. And you'll hear in a minute from her. I want to assure our residents and visitors that your health and safety remains my top priority. While we have yet to have a positive test result in Baltimore, today's news indicate that reality is not far away. That is why, out of an abundance of caution, I just approved guidance to help people who are planning to attend large gatherings remain safe and informed. The goal of this guidance is to protect people attending and working at an event, as well as safeguard individuals from the community from potential exposure to COVID-19. We also are seeking to reduce the potential for community transmission, decrease the risk of introduction of COVID-19 into new communities, and slow or decrease the potential spread of the virus. These recommendations are effective immediately and will be reassessed weekly. City-operated senior centers will remain open to provide meals, supplies, and information and referral services to those who need it. Congregate meal sites will offer boxed lunches to allow participants the choice to take their meals home rather than eating together in public settings. Individuals having trouble with adapting the new process will be referred to the home delivered meal program to have food brought directly to their homes. In addition, we are immediately canceling all city-permitted events where more than 250 people will gather. We will reassess this policy weekly. We're also recommending postponing or canceling private, non-essential mass gatherings and large community events where a large number of people are within arm's length of one another. All events geared towards people who have increased risk of severe illness, like older adults or anyone with chronic medical conditions. We will also release, after today's press conference, guidance for medium and small events. We understand that these recommendations will have a major impact on our residents and anyone who visits our city. But these recommendations were made after careful consideration and in consultation with our health expert. At this time, the Health Department, which is our lead agency on COVID-19 response, is not recommending the closure of schools or rec centers. We will closely monitor the situation and reevaluate that as necessary. Again, I want to remind the public to remain calm. And now I'll invite Dr. Zarasa to come forward and provide us with additional information.
Good afternoon. Thank you, Mayor Young, for your leadership during this response, and thank you to my fellow cabinet leadership for their support. While there are no confirmed cases of COVID-19 in Baltimore City, the health of our residents, city staff, and volunteers is our #1 priority. Based on the recommendation given earlier today by the Maryland Department of Aging and general guidance from the Centers for Disease Control and Prevention, the Baltimore City Health Department is temporarily suspending services at senior centers until further notice. As Mayor Young indicated, we will continue to provide meal services as well as serve as a resource center. As mentioned, the mayor has also released important guidance around the cancellation and postponement of mass gatherings. These steps are consistent with our commitment to taking the necessary steps in alignment with preparedness recommendations to prevent the spread of COVID-19 to protect our most vulnerable population. In alignment with the recommendations for high-risk populations from the CDC, including older adults who are over the age of 60 and people with certain underlying health conditions like heart disease, lung disease, and diabetes, these are the folks that may be at greater risk for serious COVID-19 illness. For this population, the CDC specifically recommends the following. Enlist the help of caretakers or family to help with getting food and home supplies. Reach out to your healthcare provider to request an additional supply of medication as needed. Take extra care to avoid large crowds in areas where you might come in contact with someone with COVID-19. If there is a COVID-19 outbreak in your area, stay home as much as possible to reduce your risk of catching COVID-19. The CDC also recommends deferring all cruise ship travel at this time and non-essential air travel. Symptoms of COVID-19 include shortness of breath, fever, and cough. If you are concerned about yourself or a high-risk resident with the aforementioned symptoms, call your healthcare provider or their healthcare provider for further guidance. Everyone can play a part in supporting our older adults and people most at risk. I encourage that everyone who is a family member, caregiver to older adults, or someone who is chronically ill who has a family member, neighbor, or friend who is in that high-risk category to lend a hand. Lend a hand by knowing what their medications are, help monitor their food and other supplies like oxygen, incontinence products, and create a backup plan to assist with getting additional supplies as needed. Additionally, help them stock up on non-perishable food items for their home. Caregivers who may need additional community support for their loved ones can call our Maryland Access Point at 410-396-CARE or 410-396-2273. Everyone should continue to take the everyday precautions, including avoiding close contact with people who are sick and washing your hands often with soap and water for at least 20 seconds, especially after you're blowing your nose, coughing or sneezing, or having been in a public place. If soap or water is not available, you may wash your hands with alcohol-based hand sanitizer that's at least 60% alcohol. To the extent possible, avoid touching high-touch surfaces such as doorknobs, avoid handshaking as well, and avoid touching your face, nose, eyes, and mouth. Practice routine cleaning of frequently touched surfaces. Again, for additional information on how to protect yourself and your loved ones from COVID-19, please visit our website at health.baltimorecity.gov or cdc.gov or health.maryland.gov. Again, I want to thank Mayor Young again for his significant leadership and his forward thinking, as well as a pragmatic approach to protecting the health of all of our city residents.
Could you explain how this works with the large events? I mean, are you saying don't have them? Anyone don't have them? What exactly are you saying?
Excuse me. So I'm speaking specifically about city. Can I stand up here? I'm speaking specifically about city-permitted events. City-permitted events with over 250 folks are going to be canceled. So we are going to be revoking the permits of 250 plus until March 31st. Of course, we'll be looking at the future later as well. A lot of these people are already calling us to cancel, so we are canceling all these events with 250 plus.
Can you give some examples?
The St. Patrick's Day run, the St. Patrick's Day parade. There's another run in a couple weeks that is already called to cancel.
What about private events? Weddings, anniversary parties? What's your? You don't have, I don't think you can say you can't have them.
We can't. We're making general recommendations that we are abiding by to those events.
Which is don't have them.
Over 250, that's the recommendation.
How many seniors are affected by the changes of the senior leaders?
So I'll actually have Deputy Commissioner Tan of our Department of Aging speak on that.
So we have utilization around 10,000 older adults around the senior center operations. Note that we have 7 city-operated centers and 6 nonprofit that are independently private, and they make decisions based on our own. What we are going to do is that meals will be delivered at the senior center sites in box lunches, and so those who can order ahead can have box lunches and eat them at their homes. The center staff will still be available if people need them in terms of resources and to order supplies. We're just canceling classes, special events, large gathering, and trips at this point. They can call the senior center numbers, which is available on our website. And for any questions, older adults who have questions or caregivers who have questions, they can call our 396 CARE number, our Maryland Access Point number, in which Dr. Gerasa had mentioned earlier.
Mayor, why did you call this press conference today? Why today? Why not earlier in addressing COVID-19?
Because we have to, we're getting information almost daily, almost, to the hour. So as we get information, we want to inform the public. And I think it's my duty as mayor to do just that.
Why not earlier?
I just said this is the earliest that we had availability to do the press conference. I mean,
So I was going to say, I think, Dr. Draz and I have been working really closely together about making these recommendations, getting in consultation with our other cabinet members and looking at what other jurisdictions are in the CDC guidance. Based on what we're seeing nationwide, this is very
Cheryl, you come up here, Cheryl.
This is a very preventative posture. I think we're being very proactive in our recommendation, and we're trying to balance, the rights of folks and people who've organized and want to do events with public health and safety. It's a difficult balance to strike. I think you'll find in the document that we've passed out as a guidance document that we have guidance for events that are over 250 people, events that are between 100 and 250 people, and events that are under 100 people. And we've been getting more and more questions, and people have been asking for this guidance, and we've really worked to do research about what's going on nationally and what the CDC is recommending, and to put out the best guidance at this moment in time that we can give that protects public health and safety and also balances people's rights to enjoy out in public. And we're going to keep updating them as the situation evolves, and that's, I think that's where we are.
And we did it earlier yesterday at my press conference, so I don't know how earlier I could have done it. We're doing it now, and we'll continue to do that.
Dr. Traza, the Baltimore County gave some information this morning about the number of tests being done related to Baltimore County. Can you tell us the number of tests being done related to people in Baltimore City?
So again, that number, I would have to look to the Maryland Department of Health. I think Baltimore County maybe has more of a hand around it because they now have an active case of COVID. We're made aware, again, if someone is being tested, if they come back positive. We don't run the tests ourselves. They're still being done at the Maryland Department of Health lab or through a local healthcare provider.
Do you have any idea of the demand for testing and what the status of that is? I mean, this has been a real issue nationwide.
Yeah, so I would say that, again, in talking to local healthcare partners, the demand from the public is large as far as how many actually are tested based on the symptoms that they actually have. Folks may call in and may not have the symptoms, therefore not approved, but certainly we're seeing a significant demand of people calling, wanting the test at both federally qualified health centers as well as hospitals.
Mayor, today we learned about the EMA director being placed on leave. Could you speak to that, especially during this time?
Well, I will not discuss personnel matters, but I can assure you that we have a fantastic team of emergency personnel who have combined 85 years of experience, and we're prepared to safeguard our public. I'll bring up the chief that he can speak to that earlier, but I will not, talk about the former director because we owe it to him not to discuss his personnel matters with the news media.
The fire department has historically run the Office of Emergency Management, where I think when it was founded, it might have occurred in the fire department. The individuals that we put in place, each individually, I would argue probably have more experience than probably each individual that was placed in charge over the last 10 years. They've been over most of the major significant incidents that have happened in the city. One of them also has a degree in emergency management and has served in emergency management before at this location. I'm very comfortable and very confident with their abilities and their knowledge, and they've literally hit the ground running.
Is the deputy director also on leave?
Yes.
Mr. Mayor, do you have any thoughts on the discussions in Annapolis and elsewhere about the idea of moving to a mail-in only election?
Moving to what?
A mail-in only election?
Well, I don't control the Maryland Board of Election. Whatever they decide is what we're going to, follow. We have to do that. I would hope that, people will come out and vote. There's never 250 people at the polls, so, and don't know whether that's going to be the case this year, but we want a great turnout. This is a presidential election as well. But we have to follow whatever the Maryland State Board of Election tell us to do. So we'll abide by that.
Thank you.
Thank you. And as we get updates, we'll be updating you again.
Thank you.